So what I'm going to do is I'm going to go through 3 broad categorizations. I'm going to start with the Hist structure. So the Hist stands for Health Information Systems Strengthening, Health Information Strengthening Program. That's the broad umbrella that the University of Oslo team operates under. I'm going to then talk about our domain priorities. So we've kind of divided ourselves into different domains within the University of Oslo in terms of implementation support. And so I'm going to go through each domain prioritization. These are academies, capacity building, education, supply chain, logistics, as well as health. And then I'm going to talk about the product priorities. Very broad strokes. Lars tomorrow is going to talk about what's new in DHIS2. So there's going to be a little bit of overlap, but I'm going to talk about from a very high level what is each one of the product streams taking into prioritization. So it's going to be a lot, and we're going to have to go quick. So talking about the Hist structure, what is Hist? I'm sure most of you have interacted with different Hist groups around the world. Essentially, it's a coalition of 18 local organizations run and operated independently locally. And essentially what they are there to do is day in, day out provide DHIS2 support and services to anyone using DHIS2 in that country, as well as in the region. They are all DHIS2 experts. Many of them are coming from our University of Oslo education. So they were master's students, they were PhD students coming out of University of Oslo. And they've kind of been indoctrinated into the whole DHIS2 thing and taken it back to their home countries. So you can see all the Hist logos and listed there. So they are, again, they're local organizations. Sometimes people ask us, how do we become a Hist group? Well, the answer is you probably don't. The answer is that there needs to be a local person who lives there who will be able to operate as a Hist. There is a Hist US, but they're just like Ben and Jim, right? So they're software developers. No, just Jim. It's just one guy. But really, you don't see the Hist US logo there because really we're focusing on those in-country teams. They are our connection to the field, the University of Oslo connection to the field. We are routing all of our implementation support through them, and they're feeding back to us their requirements, their use cases, anything that they need from the platform or the core. And more, the fourth point here, and this is probably the most important one, is that we are all sharing globally. We're sharing resources, we're sharing knowledge, we're sharing lessons learned, we're sharing problems. It's happening in the community of practice. It's also happening between University of Oslo and the HISP south-to-south collaboration as well. So the HISP groups are locally funded and operate through various different means. They're all independent organizations. There's no corporate entity that is HISP, right? So it's kind of a cooperative understanding that we all work together. And the various donors feed them projects and resources, as well as we do as well. And the most important part about it is that we all share a core set of values. That's DHIS2's open source principles, sharing, collaboration, community building, grassroots. If Jorn was up here, he'd probably throw in some Marxist theory that goes along with DHIS2 Foundation. I won't get into that, but the point is that, I am a little bit behind. The point is that that we all appreciate the same kind of perspective on what health information systems software needs to be. So as I mentioned, HISP is not a corporate organization. You cannot contract HISP, right? But you can work through each individual HISP partner in each country. The HISP are, though, organized for the sake of some contracts and as well as requirement gathering into what we call regional hubs. And in the next slide, I'll show you what the regional hubs are. But that's essentially a mechanism for us to more easily distribute global contracts as well as collect requirements and share user stories. And then, of course, at the University of Oslo, we are the HISP Center. So we're kind of the hub of all these operations. So here are the HISP hubs. HISP in Southern and East Africa is based out of HISP Uganda. HISP West Africa and Central Africa is based out of HISP West and Central Africa in Togo. And HISP Asia is based out, HISP, I have like 3 clickers, so I'm sorry. Okay, yeah, and HISP Asia is based out of India. Okay, and what is the role of University of Oslo? So essentially, we produce the core software products, a lot of the ones you've been seeing here. The HISP produce a lot of the innovations as well. You also produce a lot of innovations, new applications, new extensions to the core product, but we focus on developing those core about 30 apps, the API, the backends for DHIS2. They also provide generic implementation. We also provide generic implementation support. So we're getting all of that knowledge and expertise from the HISP and trying to distill it into something that's generic that we can redistribute globally. We also coordinate all the global work. We have a large research component, so we're working with the various HISP groups, the universities that they're usually associated with, to actually do academic research, to produce publications. One thing that I would have liked to have done is just shown you a list of all the publications that have come out over the last year. Most of them are very specific to DHIS2 or to health information systems generally. But that research is guiding a lot of actually what we're doing. We are an academic university. I am a researcher. Many of the folks who work on DHIS2 are active researchers. And so it's not just kind of, blowing in the wind. We're trying to ground what we're doing in solid research. All right, so let's get into some of the domains. The first one we'll talk about is capacity building in the academies. Probably most of you are familiar with what the academies are. Essentially, it's the mechanism in which we are providing the vast majority of our DHIS2 training content. So the latest features, apps, best practices. We have specific academies on certain topics and programmatic areas. And they're supplemental to in-country training. So it's not meant to replace in-country trainings necessarily, but they're meant to be kind of maybe that first step to getting people the base knowledge in which you're able to do additional in-country trainings on top of. The most important thing about the academies is it's a time to build a network, build a community. A really quick look at the academy levels. So there are 4 levels. The first one is the fundamentals at the very bottom. Who's done the Fundamentals Academy here? Oh, that's pretty awesome, actually. So the Fundamentals Academy, very base, and then level 1 academies are a little bit more specific to either to a domain or to a feature set. Who's done a level 1 academy? Okay, fewer people. All right, level 2 are much more advanced, much more topical, more technically challenging or require certain technical expertise. Any level 2s? Just a few hands now. And then there's also internal trainings, which is what many of you are working on. Here's a list of all the level 1 academies. I don't have time to go over all of them. There's a lot here, as you can see. So there's system design and use, configuration, different deployment approaches, implementations, and then some subject specific like education, data quality, and logistics. I'm going to skip that slide. Okay. And we have some new academies. So we're always developing new academies, new curriculums. We're adapting the ones that we already have as well. So we have some new level 1s coming out, which hopefully you all get to enjoy. We have a new fundamentals. This is the first time we've had a new fundamentals since 2017. And I believe we have the voice of the new fundamentals here. Yeah, there she is. Yeah, BAO was a huge help in producing the new fundamentals. We have a data quality academy now that's completely online, self-paced. I think I basically recorded that one all by myself. So if you like the sound of my voice now, you'll love listening to that academy. There's an Android configuration academy as well as a design for data use academy. Level 2, we have some new academies coming up that are quite exciting. We have our very first planning and budgeting DHIS2 implementations, which I assume the vast majority of you work on a daily basis is planning and budgeting DHIS2 implementations. This one we are going to launch in November, and we're looking for beta testers. So if this is your area of expertise, which probably a lot of you, this is your area, please help us test this academy and let us know if this is something that it's useful information, if the questions are right, content is good, et cetera. We also have an Android Implementation Academy, Community Health Information Systems Academy, Routine Health Information System Academy. We have a very new Maps and Population Mapping Academy, which is going to be pretty cool. And we have a Disease Surveillance Academy as well. If you are looking for a reason to escape DC in December, we have our first ever DHIS2 Asia and Pacific Conference coming up. So the community is spread out all over the world. Not everybody can come to Oslo, not everybody can come to DC. So We have our first one in Vietnam, December 7th through 9th. Hopefully some of you can attend or send some of your colleagues to that. That'll be really cool. The last point to make about the training is there's also a lot of technology innovations around training as well. And this app, I do want to point out, this is the DHIS2 training app. It wasn't made by the University of Oslo. It was made, oh, sorry. Okay, the training application. So this app wasn't made by the University of Oslo. It was made by WHO in partnership with ICT. This actually won the 2021 App Competition of the Year. It's an incredible application that allows you to build trainings on top of your DHIS2 instance, right? So you're able to build kind of click-by-click tutorials on top of your DHIS2 instance. You're able to push these to any user of your instance. And the really, really cool thing is you're actually able to share these with any other DHIS2 instance. So if you make a generic training on disease surveillance, for example, how to use disease surveillance dashboards, how to enter data for disease surveillance, then what you're able to do is share that publicly, and then anyone else who is using DHIS2 for that same use case can also grab your training and use it there. And so it's just one of the community innovations that are complementary to everything that we're doing here that I wanted to highlight. All right, let's talk about supply chain quickly here. Why is DHIS2 involved in supply chain? Well, there's obviously quite a lot of community innovations that have been highlighted here already around supply chain. The gist of the matter is that in order for a country to have a useful HMIS, we need to have logistics data in it. And over the last probably 5 years, we've been wrestling with what DHIS2 is in that perspective. You know, how do we handle logistics data? Are we a full-blown LMIS? Are we not? Where does the core need to sit? And so I think I will clear that up now. So there's a lot of animation here. Okay, so what are we and what are we not? At least what are we focusing on in terms of core software development and implementation guidance? We are not trying to be an upstream eLMIS, period. We don't want to handle things like supply network management, warehousing, inventory control, order management, transportation management, all of those things you see there listed on the left. We don't want to do those. That's not the core capacity of DHIS2. What we do want to focus on is what you see on the right, which is the DHIS2 in-user eLMIS component. So that's things like facility and district level stock management, cold chain management, track and trace, dashboard management, and product catalogs. I will talk about each one of these very quickly. So where does DHIS2 fit here? Kind of give you an idea of the overall structure. So you have your health information system on the right, and then you have your supply chain logistics information system on the left. And DHIS2, you see where we're kind of cutting across into the logistics spaces at that lowest level, community level, facility, hospital level. And what we're working with very closely are several upstream eLMIS systems like Medexus and mSupply that would be able to serve as your eLMIS and ERPs. So the functionalities we do want to cover are the report-based stock management. So this is your routine stock reporting from health facility level. Pretty basic stuff. It's just kind of an extension of what we're already capturing at facility level with like health data coming in on a monthly or weekly basis. The next one is more transactional, excuse me, transactional stock-based data. So this is where we're actually monitoring in real time stock distribution, stock receipts and corrections. We have an application for this, and that application right now is a little bit of a prototype, but it's being merged into our core Android application. And so you'll see this become a very generic stock functionality within DHIS2, this more transactional stock management. The next one is cold chain management. This is something that I'm just returning from Copenhagen, working with the UNICEF supply chain team there, where we are building out functionality to monitor cold chain, the life cycle of cold chain equipment. I think that you're going to find this to be a really big focus area coming up in the future. Complementary to that is remote temperature monitoring. So actually this year, our App of the Year competition winner was a DHIS2 application that connects to Bluetooth low energy temperature sensors. And so we are enabling the direct communication from temperature sensors into DHIS2. this next slide kind of illustrates that a little bit better, where you see you have multiple temperature sensors feeding into an Android app, which is then pushing to DHIS2. So this is going to be a core functionality that we want to be able to talk to your refrigerators, essentially a monitor cold chain. GS1 data matrix is a big part of supply chain. That's being completely incorporated into DHIS2 through various different QR codes, data matrices. Product catalogs, we have a large implementation or proof of concept here with the Red Cross, where you're able to monitor your entire stock, all the different types of stock that you have in your warehouse, in your health facility in DHIS2. And then, of course, it all comes back to building integrated analytics and being able to layer your service delivery, patient level data on top of your supply chain data. And so this is just an example of that from Malawi. That I kind of stole Blessing's slide there. All right, talking about the health domain now. So in the health domain, what we're trying to do is we are trying to have DHIS2 accommodate all the various different health data types that you have that are determinants for health outcomes. So that is obviously your clinical data, your routine service delivery data, obviously your supply chain data, as I just mentioned. It's also potentially your HR data. It's your, there's financial data even. And you're able to make sure you have all of that data in your DHIS2 instance, right? And this data takes many different shapes, as we've all probably experienced. Right now, we're dealing with a lot of interoperability. That's still a good opportunity. It's a good place to go. But we want to make sure for those who don't have the resources to form really complex interoperability layers that you're able to accommodate all this data in DHIS2 and build your analytics and your triangulation dashboards with all these various data sources. So we're working with WHO to make sure that their standards, their normative guidance, includes all these other various data sources as well. So, for example, if I go to the next slide, these are all of the metadata packages that we worked with WHO on. You can see that we've covered most health domains. The next step to this is expanding these packages to include all the inputs and determinants of the outcomes of these health packages. So malaria will include malaria commodity monitoring, for example, as well as monitoring for things like data quality, data triangulation, factoring things like population data, outreach campaign event data, instead of just kind of your really basic aggregate monthly data coming in, which is what that was the starting point for most of these packages. You don't need to see this. DHIS2 is being used in a lot of countries, right? All right, so let's talk a little bit about education. This is an area where we are seeing really explosive growth. Actually, it's for us on the product side, it's kind of alarming to try to keep up with this. So I will just give a quick overview of what's going on. So DHIS2 has been thrusted into the education sector. Is anyone here working in education? Three hands, okay. So this might be novel to some of you, but essentially what we're trying to do is we have currently a 6-country pilot going on for education. Each one of these countries is very different, and I'll kind of touch on some of the unique aspects of each. Essentially what we're doing is driving that routine data collection down to school level. And we're getting things like enrollment data, attendance data, marks data, both student and teacher attendance data, which is teacher attendance is arguably more important than student attendance for learning outcomes. And we're also looking at individual student tracking. So we're monitoring like issues of equality, inclusion, and quality of education outcomes. We're integrating with existing education information systems. We're reusing a lot of the expertise and DHIS2 know-how that's already in the country and expanding it into education. Now, if you know how to make a data element for health, you know how to make a data element for education too, right? And so a lot of these are complementary skills. And then, of course, there's a lot of cross-sector integration. So there's a lot of health programs. There's a lot of outreach campaigns that are happening at schools as well. And so you want to be able to get that education data tied to your health data in many use cases, in many places. So just kind of quickly going through some of the use cases, the Gambia is where this all started. It's an initiative started now, I think 2 or 3 years ago, where we needed to take their annual census, which is the only data they had coming from schools was an annual census, and drive it down to be more routine, get more frequent data. Obviously, if your only data point from every school is an annual census, there's big data gaps. And they didn't know, for example, how many kids were actually showing up to school at any given time. They didn't know teacher attendance. They had really very little perspective on learner outcomes. Were things actually getting better? Because you're very limited on what you can collect with a survey. And especially there's no longitudinal data. And so what we started to do was digitize that survey and then break it into more routine data coming in monthly or daily, and sometimes even for individual students, which is where the Gambia wants to go now, is tracking every student in the country. Togo is an interesting one because this is where we had to integrate with existing education software. So there's an information system called StatsEduc, which is existing in many countries that is monitoring student learner outcomes. And we have started to merge over StatsEduc into DHIS2. So DHIS2 would be able to monitor the student learner outcomes just like StatsEduc. And UNESCO uses StatsEduc to also report at global level. So we would be able to produce those reports for UNESCO. Sri Lanka is always very ambitious, and they are starting to build out a tracker for each individual student and teacher. So we're getting daily updates on each student, attendance, learner outcomes, and some other factors, data points. So Sri Lanka is going kind of from 0 to hero, no system to monitoring every student quite quickly. Eswatini is interesting because here we're integrating with their national ID system in education. So they have an existing national ID, and we're building that into their education. So as students move around the country, as they go from school to school, maybe they transfer, it's easier to track student movement as well. So we're getting that kind of interesting dynamic to the data. And Uganda, some animation on this slide. Uganda is interesting because we started with health in Uganda. We started with COVID-based surveillance, immunization, mass campaigns, targeting at schools, and then they said, well, we're already collecting this data at schools, why don't we just capture more education data as well? Pretty logical jump, I guess. And so that's where Uganda is pretty unique in that we're getting some really interesting triangulation between health data and education data, health data and learner outcome data, which is kind of exciting to see. You know, is your health program targeting school-age children actually having effect? Well, our education outcomes improving, as attendance improving. You know, these could be indicators of health as well. And then the last point here in education is working with the African Union to build a continent-wide continent-wide repository for education. So you can see just a quick screenshot of that. This is still in development, still quite early days, but trying to get all of the key indicators for education into a single repository. All right. I have 13 minutes to get through all the products. We can do it. How much? 2 seconds, 2 minutes. Okay. I'm sorry. That's really unfortunate for you guys. Okay, so starting with Tracker. So the point I want to make with this slide is that Tracker is no longer a baby product. Tracker is actually deployed in more countries than DHIS2 is being used as an HMIS. Tracker is actually really huge now. There are countries like Sri Lanka that are tracking every single citizen, over 22 million people. Nigeria tracks well over 20 million people in their Tracker database. So our struggle or our focus has been on Tracker performance and making sure that those massive volumes of Tracker data can be input as well as visualized and queried in a performant way. So what are some of the Tracker priorities right now? Obviously performance, as I just mentioned. We're also making sure that that DHIS2 Tracker is able to scale and expand into these additional domains that I was talking about, like logistics and education. And there's also a lot of focus now on climate and climate health data as well. We need to make sure that they're focusing on Tracker for interoperability, so improve Tracker extensibility, building in new innovations on top of Tracker. I think Austin is going to talk about that one tomorrow a little bit more. Obviously, fire resources, Austin talked about that earlier. improving integration with RapidPro. I think Lars is going to touch on that one tomorrow. And yeah, and continued integration with bespoke supply chain and education systems. Obviously, security is a big point, which I'll come back to in just one second. So just to kind of drive home the fact that tracker performance has improved dramatically over the last couple of years. It's been our principal focus as a platform, I think, was to improve tracker performance. And so this is just a quick shot of actually the Rwanda server, wherein they enrolled over 2 million people in 1 month into their COVID monitoring system. And you can see that we're handling about 35,000 requests per minute on their infrastructure, which is a pretty high volume. The next slide here is to point out, again with Rwanda, but just to make the point that we're able to process 99% of the transactions in under a second, less than 66 milliseconds. So huge volumes of data. The server is really working hard, but we feel that tracker performance is able to keep up with these really large-scale implementations. There's obviously still room for improvement, but we've made dramatic improvements. Security is a really important thing for us. I think we're focusing more on security than probably the countries or even the donors are asking us to, which is where we need to be. We need to be ahead on security as much as we can. I won't go into much detail on security, but just to point out that we have a security team. They are extremely responsive, and you need to be able to monitor. You need to be monitoring the community practice and sign up for our newsletter to make sure that you're getting notifications for any security updates. There are vulnerabilities found from time to time. They're usually not related to DHIS2. They're related to complementary products that we're using within DHIS2, like Java libraries. But these are found. We respond to them. We update. We also include security in our newsletter. So please make sure that you're tuning into these places so that you're able to get any security updates. Also, please report anytime you experience any kind of security vulnerability or issue. And we have a team that will respond to it. Some additional tracker updates. Big focus on the Capture app. Hopefully, Lars is going to go over some of the new functionality in the Tracker app. There's a long way to go with improvements on the Tracker app. So we're really at the tip of the iceberg right now. We're going to start to get in some really cool functionality. We're off line listing application. Hopefully you're all experienced the new line listing application. It's come a long way to be able to visualize various elements of tracker data. And of course the WHO metadata packages that I was referring to earlier are now incorporating individual level case data, which is exciting to see. On the Tracker app specifically, we're going to be in the very near future, which I'm not telling you a release number or a date, but in the very near future, we're doing things like improving tracker referrals, bulk tracked entity operations, improvement in deduplication tools, and then obviously tracker analytics. Now moving on really quickly to Android, and surprise, surprise, the Android priorities are also performance, stability, and security. Some of the key functionalities for Android are this new case-based module where we're working with very specific programs like the real-time stock management tool and EMIS to build those kind of as more parallel apps, understand those use cases, understand those requirements, and then bring those back into the core Android application. We also appreciate there are moments when the core Android application can't be everything to everyone. So it could be that the education app remains a separate app, but is supported by the core software development team. Maps, integrating a lot more with maps in the Android application. So we have continuous improvements to the UI. Hopefully you've noticed that's become much easier to use. And then we're also enabling data capture in maps with tracked entities and events. And you can see a screenshot of that. Local analytics, so you obviously, with the data that you're capturing on your device, you want to be able to visualize that data in real time. And so we're improving things like support for program indicator boundaries, support for missing aggregation types, and support for line listing tables in the local analytics of the Android app. And then the Android app needs to be, first and foremost, a workflow support tool. So we are incorporating things like to-do lists, navigating in calendar view, and different types of tasks. And so you can see some screenshots of what's to come with the workflow support tools. Working list is also an addition for the Android application. So this is following a defined working list or list of tracked entities that the clinician or the user will operate from. Big improvements to the SDK, so if there are any Android app developers out there, one of the big focuses is the incorporation of some UI components like the organizational unit tree, value type forms, and the rendering types. The SDK is continuously improving as well, so enabling metadata granular syncs and offline and online modes. And then the analytics, which is definitely the coolest part. And so what we're focusing on analytics, I'll skip this slide because you'll see it now. Analytics tracker performance is our biggest focus. We have got to improve analytics tracker performance. You're seeing that countries have gone massive scale with tracker, 22 million tracked entities. You need to be able to query those databases and visualize your program indicators, line lists of tracked entities or patients, as performant as we can possibly do it. Where are the problems right now? The problem right now is largely focused on enrollment type program indicators. So if you have large scale tracker programs and you're dependent upon enrollment type program indicators, if you're using a current version of DHIS2, the bad news is that they're not working well for you, right? So let's just be honest about it. And this is a big focus of what we're trying to improve. Now, if you're under maybe 50,000 tracked entities, probably everything is okay. But as you're getting into the millions of tracked entities, millions of patients, stuff starts to slow down. If you can avoid enrollment type program indicators, I would recommend you do that. We have some guidance documentation on this as well on our website on some workarounds and some strategies to improve. The point that I'm trying to make is we know it's a problem. It's going to be a huge focus of the work that we're doing in the near future to improve tracker performance, analytics performance. We're also working on cross-program and relationship analytics. So we are, I did put a number here, targeting 241 and 242. Please don't take a photo. And the point here is that we are building out the line listing application to be able to view data from multiple programs for a single tracked entity. Again, this means that we have to build a new backend, and that backend has to be extremely performant. So we got to build a backend, and we need to make it good, right? And that's going to take some time. It's not a small undertaking. It's a lot of work, but it is a high priority for us. Maps, I won't talk too much about this because Lars is going to mention a lot of this tomorrow, but we have some massive improvements with like catchment areas for individual health facilities. So everybody's just like, how many people live within the catchment area for this health facility? So we're working with partners like Grid3 and Crosscut to automatically generate those catchment areas. And then we can attribute population and even number of household structures through Google Earth Engine and excuse me, some other sources to be able to give you some pretty actionable data about how many people live in a health facility, where do they live, and you can layer additional health programmatic data on top of it. So where do people live who have the lowest vaccine coverage, for example? And you can have targeted outreach campaigns, et cetera, based upon that data. Another big focus is, I'll ask a question, maybe this is about the wrong audience to ask the question. How many of you have checked your DHIS2 dashboards today? Yeah, just Jill. All right. Jill, of course, she would because, you know, she's on it. But how many of you checked your email today? Yeah, how many times have you checked your email today, right? So the point being is that people don't check their DHIS2 dashboards. We know that, right? No one checks dashboards. We know that. But the point is that we need to be able to send data to where people actually spend their time, which is on their phones, in their email, right? We need to send alerts and notifications. We need to send the dashboards. We need to send the analytics to where people actually work, which is not on a DHIS2 dashboard, as much as it pains me to say it. So a big focus is going to be revamping the push analysis functionality, which is how we send data, or we send dashboards to emails, and then enabling a secure, you're going to hate me for saying it, Austin, but enabling some kind of secure way to access dashboards externally without a login, right? And the security part is the biggest part to that. It's very, you know, there are workarounds. It's very easy to hack together some kind of external web portal that is not secure, but we are going to figure out a secure generic way that will allow you to be able to easily push a dashboard to someone who needs to see it, regardless if they have a login. And then the final point that I want to make on, well, probably the final point, on analytics is supporting the lowest level data users. So we're seeing a lot of really cool dashboards here, and all the dashboards here are for national level, global level, right? Specifically in this conference. But our target end users are at subnational level for our analytics. If we can make things work for subnational level, then it probably also works for folks like yourselves at global level. And if that doesn't work, then you probably have the resources to go with Tableau or Power BI or any other really cool analytics tools that we've seen demonstrated here, which are fantastic, but we don't see a lot of penetration of those tools to lowest level. So DHIS2 has to accommodate the analytics and data use requirements for people at subnational level. And we are building a lot of functionalities. We have continuous communication with several countries. We have a system called we have an approach called the Districts of Excellence approach, where we have basically WhatsApp chat groups with folks in Zambia, Rwanda, Uganda, probably I think it's about a half dozen countries or so, where we're talking to people at district level, saying what's wrong, what do you need, how's it going? And they're sending us requirements, asking questions, and we're documenting all of these, we're building user stories, and we're packaging them into new functionalities. One of the biggest functionalities that has come out of this is the ability to make on-the-fly calculations in a pivot table. So you know how you in Excel, you click on if you're in Microsoft Excel, you click on a cell, and you do equal sign, and you put in a calculation, and you're able to do that? We're going to try to do the same thing in DHIS2, right? So if you're at district level, you don't have to call the HMIS manager to try to get a new indicator added so that you can visualize it in your pivot table, right? The point is that you're going to be able to, as a district health officer, make that calculation right there in your pivot table and visualize that data without having to go through the process of getting it added officially as an indicator. Now, it won't be added to anyone else's dashboard. It'll be just saved to that one pivot table. So other people won't have access to it. You're not making a new indicator. You're just making a local calculation. So you can see some mock-ups for that. Hopefully that's coming pretty soon. Last slide, I promise, is we're hiring. Obviously, it's pretty hard to find DHIS2 experts. I think we've probably all experienced that. Most everybody seems to be fairly well employed, but we are hiring 2 positions, DHIS2 implementation specialist for Latin America and the Caribbean, as well as a DHIS2 training materials specialist. So that is it. Let's go get a drink.